Yes, definitely would like to express the gratitude from the team for prioritizing attending the session today over a couple of hours of extra sleep, given that it's Sunday today. So, thank you all for joining. And yes, let's start with a little context about Healthy Minds World. For those of you who've been a part of our journey so far, thank you so much. Your presence in itself is a huge support for us, and one of the reasons uh, for us to be able to reach where we are today. And for those of you who are joining us today for the first time, let's hope you have an enlightening session. And hence, I'm going to start with a little context about who we are, how we came to be. So, Healthy Minds World as an online platform was started by Pallav and Vivek almost 5 to 6 months back, almost the same time as when the pandemic hit us. And their conversations in terms of understanding not just the impact on their professional front, but also the personal front kind of highlighted that at a time like this, the need for increased conversations around mental health, positive mental well-being was a need of the hour, and especially for those who had already been facing some kind of psychological, or even those who had been psychologically locked in. For them especially, the physical lockdown meant aggravated situation. So that kind of brought about this realization that we need to have more we need to have increased conversations around mental health and understand it from a comprehensive perspective, right? Not just offer professional help, but we also wanted to understand that how exactly mental health as a phenomenon functions. And so we decided conducting workshops and webinars both from an academic perspective as well as from an awareness aspect for someone even who's not from the psychological from the academic side, right, of psychology. It's easy for them to understand as well. And so we started conducting sessions. Some of them have been around psychoanalytic school of thought. There's been psychotherapy, clinical psychology, forensic psychology, and a lot more. And with that, our intention essentially is to help in a country like ours, where mental health unfortunately even today is still carries a huge stigma around it. Our aim essentially is to bring about a wholesome understanding and, in fact, lead better and content lives. So, with that, we've also, I'm not going to go into too much details there. If you would like to know more about what we're doing, what's happening, we will be sharing the links to our social media channels, to the website. Please feel free to have a look. And yes, talking about a session today, before I move on to that, I would also like to quickly take you guys through the last session we had concluded a couple of weeks back, which was around making women's mental health a priority. And through that, essentially, our objective was to understand that when it comes to a woman's life and the different stages of it, the way the stages uh, kind of push forward challenges, and how each of those challenges affect not just her psychological state but also her physical and financial state. So we had conducted sessions around understanding what are the best ways that one can overcome these, especially from we had a lot of professionals on board with us who helped us understand what are the best ways to identify it, to seek help, and move forward. So and yes, if you would like to watch the series, we will be as I mentioned, we will be sharing the links to our channels, so please feel free to look them up. And yes, so with that, we'd also realized the conversations we've been having with you guys, be it on Instagram, be it on Facebook, or even personally, for those of you who've reached out to us, we've had this realization, right, that when it comes to mental health, there are many things that come into force, especially developing a deeper understanding in today's world. Even for people who are not from the psychology background, it's easy for them to presume that they have a deeper understanding only on the basis of, say, browsing a couple of websites, or even pop culture being the main source of information. However, there's also an equal threat in terms of unverified information, false information that we can easily fall prey to. Hence, through the series, we would want to develop a deeper understanding, given that there are a broad range of mental health disorders that exist. To name some of them, there is anxiety, there is depression, there's bipolar disorder, there is obsessive compulsive disorder, post traumatic disorder, and a lot more, right? And each of them have varying symptoms, which sometimes might also coincide. And these are marked by characteristics in the form of unusual or abnormal thoughts. There are an array of emotions, behavioral patterns, and even relationships with other people that can influence them. So through the series, as you watched in the video as well, that our intention is to get into the details, right? And especially from a professional's perspective, to understand what are the various causes, what are the various implications of these mental health disorders through through our Sunday series. And talking about our session for today, I would want to briefly introduce as to why and what the topic is. So, interpreting depression is our topic for today, and the reason why we've chosen depression is also quite interesting, right? Especially okay, so let me put it this way. Depression is a term that unfortunately people play around with and use it quite lightly, right? I mean, the number of times that I've heard people using the term, the term, say, I'm undergoing depression, or I think I'm depressed, casually, is something that I don't think I can count on my fingers, right? I'm sure you guys might have come across it as well. And these are situations where people either self-diagnose, or it's essentially undiagnosed depression, right? Which is not just which is dangerous to be I think that's the only way we can understand it. And yes, unfortunately, when we look at the stats as well, as per WHO reports, it's quite alarming that almost 1 in 20 Indians suffer from depression, while on a global level the number lies around 450 million, which kind of then nudges us to basically ensure that when it comes to depression, it's not something that should be lightly, and hence we need to have a professional's understanding. So through our session today, our objective is to understand depression in terms of what are its to get a wholesome approach basically on depression, from what are the symptoms, what are the implications, how can one seek help as an individual, or get support in terms of help providing help to another person, especially at the right time, because with depression, one of the important factors is also getting timely help. And yes, essentially, that's what we're going to cover today. And before I request a speaker for today to join us, I would quickly want to introduce her. We have with us Mrs. Shraddha Sidhwani, who will be helping us, who will be enlightening us on depression from a professional perspective. She is the founder of Ray Reality and You Foundation. She's also a RCI certified psychologist and psychotherapist. And she is also a trained associate and supervisor from the Albert uh, Ellis Institute, USA. Ma'am, I request you to please join us.
Hi, good morning.
Hi, good morning. How are you?
Good. Hope everything is safe.
Oh, yes, definitely. Hope things are well at your end too.
Yes, definitely.
Thank you so much for joining our session today. I was just taking our participants, through a brief introduction.
Right,
And right, so what we've planned is we have a few questions that we would, want to discuss with you to get a deeper understanding when it comes to interpreting depression. And as for the participants, when they do have any queries with respect to a topic being discussed at the moment, we have a team of panelists who can help us navigate the questions. Does that
right.
work for you?
Yes, that's fine.
Okay, perfect. So I think on that note, then let's begin the session today, and hope we helps us understand depression from an expert perspective and not uh, you know unfortunately the way things go around today.
Right.
Uh, anyway, so yeah, with that. So my first question to you is about understanding depression. How would you suggest that? How is depression defined, and what are the stages? I mean, do you think there are stages to depression, and if yes, then what are the stages of depression that a person goes through?
So I think very clearly I want to start off by saying that depression is termed as a mental disorder. So when we are terming it as a mental disorder, we have researched on it. There are certain criteria that a person has to meet to be called a depressed client. Some of the criteria, if I can say, which are also the symptoms of depression, are basically we start from your physiological criteria of any kind of behavioral change. So you do not feel like eating, you feel helpless, you feel worthless in terms of your thought patterns. Physiologically, like I said, the sleep is disrupted, your appetite is disrupted. So at a certain times people may eat more or not feel hungry at all. There are patients who in depression who sleep excessively or lose their sleep. So there it depends on a very individual and is very subjective to every person. People also have a lot of ruminating thoughts in terms of depression. So like I said, the worthlessness, hopelessness, I don't feel good enough, I want to end my life. And yes, we definitely do ask for suicide ideation, which is any thought of self harm. So a lot of people have this misconception that if you ask for whether a person is suicidal, it sort of puts a thought into their mind. That is not true. We need to ask and assess whether there is any form of suicidal ideation or self harm. Some people also have something called agitated depression, which is an overt form of depression. You will see them getting snappy, irritable, very short tempered, and having excessive mood instability. So any form of behavioral as well as physiological change is very important. So it is not only sadness. This is extreme levels, prolonged levels. We have a person who is feeling extreme levels of low for more than 2 weeks, has to fit certain criterias, like I said. And only if he meets certain criterias and meets we have psychometric assessments which we do. And once he is clinically diagnosed as depression, then he can either seek therapy or any form of antidepressant medication. So this is not a feeling of sadness which comes and goes on and off, which we probably are facing during the pandemic right now.
Right, right.
Right.
Do you think there are stages of depression as well that one undergoes?
So I think there is a mild, moderate, and severe form of depression. So depression can be mild symptoms as well. So people, are definitely function. I think from the current media, there are a lot of myths flowing, like you have said earlier, is that people in depression don't smile, people don't function. I don't think that is true, because we see a lot of depressed patients who are actually functional with their work, their family life. They are trying to cope through the depression is what but that not to say that they are not depressed. So they could fall into a mild or moderate category of depression. Yes, a person who is severely depressed have a severe change in behavior, is getting extreme thoughts which they are not able to control in their mind. So it's like your mind is controlling you and you're not able to control your mind yourself.
Right, right.
Right.
Uh,
So a person who is not treated in terms of a mild stage of depression and then a prolonged depression can lead to a severe case of depression in that form.
okay. Thank you. I think we have a solid context set for the discussion. We have, when it comes to depression, key points that we need to take into account is how some of the symptoms that you have mentioned are some of the things, also about what are the different stages. I think with that understanding, then my next question to you is about do you think a person can identify if they are undergoing depression on their own?
Definitely. So like I said, any form of behavioral change, including this, when we're talking about children as well as adults. So any form of behavioral change, even in children, any kind of avoidance behavior or any kind of aggressive outburst in children, any kind of bedwetting, any kind of extreme withdrawn behavior from kids, extreme stages of aggression, trying to be isolated, losing interaction with their peers, are all basic indicators for depression. So people can try to see if they are going into extreme forms of behavior, extreme withdrawn, they are not enjoying activities of daily life which they were doing earlier. For example, if I was cooking or doing my exercise and I don't currently feel like doing that, and I'm feeling absolutely invalidated, empty, I'm feeling a void, I don't feel like calling my friends. So these are basically suggesting that your body or the mind is basically shutting down. So a lot of times people say that we don't wake up feeling fresh, or sometimes there is a seasonal depression in terms of winter depression. When the sun is less in most countries, during the winter, you see that people feel low in the evening and they feel depressed. So those are a seasonal pattern to a depression. So you can identify your change in your behavioral pattern, change in the thinking pattern, and obviously there's a change in the feeling pattern. So I think we need to try to see all three aspects.
Understood. And this then applies to not just an individual, but also for people around us, right? Especially in
Right.
families, if one has to look out for warning symptoms.
Right. So like I said, so in terms of sleep, appetite, those are the main symptoms. Withdrawn behavior, interpersonal relationships, the person is breaking down the interpersonal relationships. I think that is also one of the key signs where you could, and that is why in COVID, I think what most of us are doing is sort of checking in on each other, which will help us to see that yes, the other person on the other spectrum is coping well.
Definitely, definitely.
Right.
So we have a few questions from the participants, based
Right.
on the lines of the discussion we're having. The first is about while talking about the different stages. So the question is, are there any timelines associated with these stages? Example, if something is prolonged for say more than 2 weeks, could that be classified as moderate, for example?
Anything which is prolonged for 2 weeks, more than 2 weeks, and you are in a low state of mind could lead to a depression. There's something called dysthymia also. Dysthymia is a feeling of low. You're not feeling your optimal for the last 2 years. So you're not constantly, there is no abrupt change in terms of a depression where you're feeling suicidal, or there's no abrupt change in terms of the behavior, but you have been in a form of a lull for more than 2 years. So a lot of people come to us which is with an undetected form of depression, because or come to us in severe states of depression but have been feeling lows in the last 2 years. So I think it's very important for the clinician or the practitioner or the therapist to have, a concrete evaluation of what stage the person is on. People who have mild and moderate symptoms are trying to cope with life, are trying to function with life, but are not adequately feeling adequate enough. Of course, there are biological causes to the depression, so there could be any hormonal imbalances in the body, in terms of thyroid, any other terms, hormones such as progesterone has a fluctuation in mood. So you need to assess those as well. Any lifestyle changes, any abrupt changes in, like a pandemic would be a significant change leading a person to a depression. Changes in terms of losing your job, financial situations, losing a family member. So in terms of losing in to death, there is a period of grief, which will not be classified as depression, but anything after that needs to be assessed whether the person is able to cope with the symptoms of grief or not. So I think there is no fixed criteria for mild moderate depression, but we do have psychometric tests, we do have symptoms that we need to identify, and then we take it forward.
Right. I think the way to then proceed is definitely not undergo self-diagnosis, but seek a
Right. So if you feel that you're feeling low, go in for a single session of therapy. Try to assess. I'm sure the clinician or the practitioner or a therapist could identify immediately that, if it is severe enough for it to be warrant a depression in the first place. Or is it just an adjustment issue that you're having for the timeline?
Right, right.
Right.
Definitely. So my next question to you is about from okay, this is another participant. The question is, how can we help someone who isn't willing to accept that they're facing from depression?
Right. So, yes, there are a lot of people who may not feel like seeking help because of the stigma associated with mental disorders. But a lot of depressed people do come and ask for help. So, in depression, what happens is there is a lot of guilt, a lot of self blame, there's a lot of worthlessness. Like I said, I'm not good enough. So, generally, people do identify and want to seek help. The only issue is bringing them to a practitioner. So you can sort of seek help on behalf of them. You can talk to a therapist on behalf of them. Try to understand that is there any, so people have this thing that, okay, if I'm depressed, I necessarily have to take some form of antidepressant medicines. There are a lot of myths about the effects of the medicines and the side effects of the medicines. They have to be long term or short term. So I think you need to go to a therapist, figure out whether the depression can be handled in terms of therapy or also is severe enough to warrant some form of medication. So I think we need to open up and see. And in case your relative or friend or your child is not able to go to a therapist, you can go to the therapist, understand the profile, what can you do to a person who is undergoing depression. For example, the other day I had a father who came up to me with for his 23-year-old child, and he said he's not ready to seek help, he's not ready to accept that he's going to get depressed. But having a conversation with the parent enable the parent to understand the state of mind of the child. And slowly in the second or third session, the child came along and sort of build that relation with the dad and started accepting that he is not feeling well.
Right.
So I think we have certain psychological barriers which we have created because of the stigma associated in India still. But I think we don't need to hold up those barriers that, if he's depressed, he needs to go. I think it's more family therapy. So you can, get the knowledge for yourself and try to help a significant other in the family.
Definitely. I think that's quite
And
hard.
most often, I think, along with the biological factors, there are a lot of social factors leading to depression. There could be breakups, there could be family issues, there could be divorce, there could be death in the family, like I said, interpersonal issues with people. A lot of students have come back home, not used to staying with the parents. They've been used to their freedom, independence. So there are various, factors in today's time which are leading to depression.
True, true.
Especially among the youth, they were looking forward to go to their colleges. We don't know when colleges are open. They're not able to sort of meet their friends, because of the cases of COVID increasing. Although, of course, we are seeing that the lockdowns have been released. But a lot of, parents may have conflicting views with the child. When I'm talking about children, I'm talking about the age from 20 to 35. So a lot of patterns have changed. We are used to certain patterns of thinking. And I think what needs to be identified is, where am I going wrong, or where is my child going wrong in the pattern of thinking?
Right, right. You rightly pointed out. I mean,
Yeah,
definitely with the pandemic, things haven't been easy at all. And
right,
the, the age group that we're talking about, there's a completely different set of challenges that one faces, and it's quite also easy to, I mean, confuse
right.
between the situation. So with that, my question then to you is there, anything called as the right time to diagnose depression? And, or sorry, what is the right time that one can seek help, uh,
Right.
in terms of, what the symptoms are? And there's a second part of the question too. What role do you think does psychotherapy play, when it comes to the treatment?
Okay, so in terms of the timing, I don't think there is any specific time. The minute you see abrupt changes, or you see a person, shutting down, behavioral changes, becoming too aggressive, I think you need to intimate yourself. Don't, sometimes people feel, ki, oh, it's a phase, it's the COVID, it's the lockdown, it will go away, and, let me give it time. Yes, you can give it a few weeks, but beyond that, if you see that the person is not able to interact, not able to manage his basic routine, please, seek help. And there is no harm in seeking help, because we are not forcing you in terms of the medication. We are not forcing you to do anything that you don't want to do. In terms of psychotherapy, let me start by saying that counseling is a very structured, goal oriented activity. So, unlike the normal advice seeking, counseling has particular goals that have to be achieved in terms of the therapy sessions. Now, therapy sessions not necessarily have to prolong for 6 to 8 months. They are definitely expensive. There are therapists, private therapists who are charging a lot. So therapy sessions are limited to the issues related to the client. So if a client is coming down with, anxiety issues, depression issues, anger issues, we sort of start dealing with those issues in the session. So in terms of depression, there's a lot of guilt feelings, or I have not done enough, or I should have achieved so much. That helplessness, worthlessness, I have put down my friends, or I have had a breakup. And there are also themes of addiction which come up with depression. So a lot of cases which, people have been addicted to alcohol, drugs, they tend to have an underlying depression. So therapy helps us to identify the core issues or the core thinking patterns. Now, of course, it is a depression because it is going dysfunctional. Now, when I'm talking about dysfunctional, we're having extreme emotions of hurt, guilt, shame, embarrassment, anger, and we are withdrawing, not connecting, or we are extremely reacting rather than responding.
Right.
So I think the themes need to be identified. The tolerance to frustration is reduced. In terms of a depression, you feel you can't handle it, absolutely. Okay, so in therapy, especially in cognitive behavioral therapy, which I practice, is we are challenging your distorted cognitions, which is your thought patterns, and we are trying to give you an objective reality of how you can shift and change. So getting some kind of flexibility in the thinking is what is necessary. So this is all goes down to your neuroscience. I think what COVID has shown us, the brain has some amount of neuroplasticity. It has the ability to sort of adapt to situations. We were not used to wearing masks and using sanitizers and going out with, face shields. So COVID has basically shown us that the brain can has the ability to adapt. Whether it's a lockdown or whether we free lockdowns. So in that way, what is the cognitive ability then to adapt? So each individual has to identify what is the flexibility within that individual. So create that cognitive flexibility and then move forward with life. So in therapy, we are basically teaching them that this external situation may or not may not change, but the person has to adapt to the situation. and then thereby coming to more functional emotions of maybe, of course there are certain situations you may not like. You may not like the lockdowns or the colleges being closed, but you can still be sad and upset about it, but you don't have to be depressed about it. So I think what needs to be highlighted here is that there are normal emotions of sadness. You are going to be a little irritated in certain situations. You are going to be disappointed in certain situations, especially now. Uh, but those are normal emotions. Those are not dysfunctional emotions. They're not extreme emotions. And they also allow us to, move assertively in our communications, move assertively in our relationships.
True, true. I think that's definitely important. And also talking about, I think we've restricted ourselves, the conversation to a specific age group. But I was just going through the questions. I think we have a lot of them that are directed towards youngsters, towards children. And I think we also have a lot of counselors and psychologists on the, uh, with us
Right.
today who work with children. So can you help us understand that how can one identify depression in children, uh, be it at school or even in the current setting, for example?
So I think with children, it is very obviously that any form of behavioral change, like I said, any kind of disruptive sleep pattern, disruptive eating patterns, those are the signs which you will automatically pick up because you will notice that the child's behavior has changed. The child extremely becomes withdrawn or becomes extremely fearful, and then either there has been a death or he's fearing COVID. So I think there are clear-cut behavioral signs in children. Of course, your physiological signs, like I said, are there. The communication levels become less. Some people or some children tend to get into bedwetting, extreme flares. Some children also cling to the parents. So we've seen a lot of cases where children have started clinging to their parents. There's crying behavior excessively, clinging behavior. They are not letting, there's a separation anxiety seen with parents. So they're not able to, separate from their parents, even if their parents are, of course, parents have been at home for a large amount of time right now. So if they have started work, the child is extremely throwing tantrums. So these behavioral changes are very important in children. We do have therapy for children as well. Of course, we do not promote, especially in India, a large amount of medication in children. So but there are children who also, talk about very dark phases of, harming themselves. you know so we need to sort of understand that it's not a phase. The child may be feeling significantly low and may require attention in terms of therapy. With children, what we do is some sort of play therapy where we engage in activities in therapy to understand the emotional state, and we help them change the emotional state of mind. So again, we help them move out of a rigid cognitive zone to become more flexible and playful.
Right. Perfect. I think that answers the point. Moving on, we have another question with respect to the stages. How do you think can we understand the mild, moderate, and major forms of depression?
So we do have personality tests. There, some of them are called the 16PF, MMPI. We have the MCMI. These are all standardized tests in the world. They have been researched with various populations. We also have them in India, and we are definitely using them. These standardized tests also give us a degree of the depression. So we can clearly evaluate. There are levels of up to 75 to 80 to 85. So anything above 75 would definitely be a moderate and a severe depression, which warrants some form of medication. So I think personality test would be one of the ways other than going to a clinician and identifying your symptoms. But of course, somebody has to be trained in them to evaluate a depression. We also have depression inventories and clinical scales we have, which can be used on patients for depression or for suicide.
Okay.
Yeah.
Right. I think moving on then, when if we have to do a comparison of understanding depression across different geographies, what do you think are, say, the similarities or the differences between the case of depression in India versus the US?
So, since I have trained from the US, I can tell you, I don't see there is any kind of differences in the terms of depression. So, when you're looking at the psychopathology, I think we are globally or universally looking at it, because human behavior is work in patterns. You know, we perceive things, we identify things, we use our experience, and we respond to things. So, I think what when we are studying human behavior psychology, we are looking at it globally rather than looking at it in different cultures. The themes of depression tend to change. In of course across gender, we see women are more prone to depression. Definitely, it's also because of the hormonal imbalances that women have. There is postpartum depression, there is premenopausal depression, which we are highly seeing in women. In terms of like the themes, like I said, in India, of course, we have not seen in the last couple of years the trend is changing, where we have more people coming up and speaking about depression. Therefore, the rates of depression have significantly gone up. So it is not that it differs from the US or the UK. It is because today, as a society, we have acknowledged, we have accepted, and we are talking about it more. So the sensitization in the population has come more. People are seeking more help, and I think that is where we are seeing higher rates of depression today. Also, if you see, there are certain factors which may be your economical financial issues, which may prevail more in a country like India. The population issues, the interpersonal issues. So in terms of living standards, we tend to have a lot of living in joint families. We have 4 to 5 people living in a single household, and there are interpersonal issues there which could lead to some kind of depression or agitation. So I think in that way the trend may be different, but I think globally, what themes we are seeing, what we identify in patients, whether they are abroad or in India, remains the same.
Right. Okay. I think that's important to understand, that, irrespective of your geography or even the external environment, the factors kind of, you know, coincide.
Right. Only except for in cold countries or wherever, like I said, there were high chances of winter depression. So in terms of that, the chances of depression are more because of the weather changes that are going through.
Definitely. Uh, right. I think that's a great insight. I have a few questions, which, just a second. Right. Yeah. So my next question is about. Sorry. Do you think can an innate vulnerability to depression be avoided by regular preventive measures in the form of meditation or gratitude practices?
Innate vulnerability, right? So yes, depression is also known to be caused by genetic factors, if that's what you are calling innate vulnerability. So if there has been history of depression in the family, the chances are that higher chances of the person going through depression. For example, if my mother has got the depression, there are higher chances for me to have certain signs and symptoms of depression or suffer from depression. So we do take a very detailed history of the patient, any detailed attempt of suicide in the family, so to identify whether there is an biological vulnerability in the person, because there is a genetic predisposition in psychological disorders. Now, in terms of if there is a genetic vulnerability or a high case of depression in the family, then the person may warrant some form of antidepressant medicines. And we generally, there is a lot of studies done where we see that the same form of chemicals which were used by your parents, could work on you in terms of handling your depression. So mindfulness, meditation are definitely practices. Especially mindfulness is quite a research practice today. So I don't know if you're aware, but we do have dialectal behavioral therapy where we use mindfulness. We have Stephen Hayes, who's spoken about mindfulness therapy. So I think mindfulness is about focusing on the here and now, acknowledging your thought patterns, acknowledging your emotions that are there in the year, and processing the pain, and then seeking some kind of relief from that. So it is not going back to your past as we were doing into your childhood. It is assessing your trauma right now and helping you deal with that trauma. Meditation is, yes, used. Meditation, when we are talking about meditation, we are talking about focused meditation, focused on your breathing. So that is definitely there in relaxation breathing. Biofeedback mechanisms are known to help the anxiety and the overwhelming feeling that you have with a depressed person.
Okay, definitely. I
Right.
think that's important. Moving on, we have a couple of questions in terms of comparative forms of identification. So, first is with respect to gender. Do you feel uh, is depression more common in women than men? And if yes, then why?
So, like I said before, there is a lot of research on this that yes, gender wise, women are more predisposed to depression is because of the biological makeup of the woman and the man. So, there is estrogen, progesterone, there are hormones which are going up and down. So, there are women who are more prone. This also comes to the social factor that women tend to talk more about their depression and their issues. So it can also be that women are tend to share their issues, talk about their issues. There have also been studies where they say that women seek help more often than men. And this comes up to the whole the ego, and I'm a man and I want to be macho. So there are a lot of social factors also which could give us this difference of rates as to why women tend to have more rates of depression than men.
Certainly, certainly.
Yeah.
And my next question is in a comparison between introverts and extroverts. Do you think introverts are more prone to depression than extroverts?
So I think what here we need to see in terms of a personality profile is not necessarily introverts will be more depressed. I mean, there is no hard and fast rule like that, but definitely they could have developed their own coping mechanisms, such as introverts would like to like read more, watch their movies, indulge in their work, engage in self um, activities which are secluded, such as music. So there is no rule like that. But yes, extroverts tend to talk about their feelings more. They have more avenues to sort of release their depression in that way. So that could help help them with their depression.
Right. And I think we have an interesting side to it then. What are your thoughts on ambiverts then?
Right. So I think what we need to is, rather than globally analyzing it like this, we need to understand what the coping mechanism of the person is. So depending on the coping mechanism of the person, regardless of whether they are introverts or extroverts, we also sort of assess the coping mechanism of the individual and help them to build a coping mechanism in therapy. So you look at the adversity of the problem, okay, and then you try to help them to reach to various solutions of the problem. People who have a lot of cognitive rigidity, okay, then look at the problem from a very negative or pessimistic view. And so we sort of try to help them to find alternatives and to accept sort of sometimes there are people say, what is the best alternative out of the worst, and we sort of look at the least worst alternative. So there may be no best alternative here, there may be no positive alternative, but what is the least affecting alternative to you?
Right, right. No, I think that's
Right.
a valid point because I think in the in today's time,
Right.
many people identify themselves as ambivert, which is which has sides of both personalities. So not it's not like a black and white.
No, it's not a all or nothing thing. It's not a black and white perspective. It is basically depending on your genetic vulnerability, your social support that you have. What are your hobbies and interests which have been there. What is the rate of depression that you're facing through right now. Is it about loneliness today in COVID? So a lot of people are, even if they were extroverts, because they have been very isolated today, they are very vulnerable to depression. They may have a very large group of friends, but the loneliness and the void and not being able to go back to their current lifestyle is going to cause them the depression.
Definitely. That I think is an extremely insightful point. Talking about one of the aspects, I think more sensitive and serious one that we haven't touched upon yet is, do you think it's necessary that if a person is undergoing depression, they will have suicide ideation as well?
No, that is not necessary. So, somebody who's going through mild to moderate depression may not have extreme suicidal behavior or thoughts. There may be no attempts of self-harm, but we still have to help the client with the depression. So don't dismiss anybody who's coming to you and saying there's a drastic change in their behavior and they are not able to cope. You can't dismiss them and not being depressed. Of course, suicide is a very, very important sign. Do not ignore it again. So if somebody has been threatening suicide also, we have to take it very seriously. Do not dismiss it that it's a state of mind. It may go away. It could be a long standing depression which you are not aware of. And often enough in my conversations with clients, we see somebody who's seeking depression after 5 years, but then they go back and say, from my teenage years I was feeling like that, or in the last 5 years in my marriage I have been feeling like that, but I have not had the courage to go and speak to somebody.
Right.
Right.
Uh, right. I think we move on quickly to a couple of other questions that we have. With respect to, overcoming depression, do you think it is completely curable, or there can be, the possibility of recurring episodes later on in life?
So yes, the answer would be both yes to both of the questions. Yes, it is recurring as well. So people who there are people and who have been identified in research that their depression could be reoccurring in their cases. We also have been hearing a lot about bipolar disorders where there is a hyperactive phase and a depressive phase and a cyclic period to this depression. Where the person is very hyperactive for 3 months of their life and 3 months of the life they feel very low. Now these things have to be monitored with a psychiatrist, with a therapist. At the same time, depression, single episodes of depression are fully curable, and therefore therapy comes in there. So if you seek CBT, REBT, or any other form of therapy, the goal of therapy is to reduce the rate of relapse, so that tomorrow if you are feeling low at any given point of time in your life, you have the tools to sort of pull yourself out of that low. So therapy is empowering the patient or the client with a certain set of tools that will enable him to function in life effectively, regardless of the environment or the stage of life he is in. So even if he's in his 30s today and he comes to, in his 50s also, he could go through a problem or a financial loss, or a relationship loss, which is when he can use those tools.
Definitely. I think it's important to understand, again, kind of reiterating the fact that not forming conclusions on the basis of whatever information we come across casually, but getting, professional insight is critical to overcome the situation in the
Right.
right best possible manner. While talking about the different age groups, I feel like different sections, there is another um, section that is uh, with respect to old age. How do you think can we help people in old age depression, especially during the pandemic?
Right. So I think what has happened with most of our seniors is they've lost their connections. And I think that loneliness has been a very, very important factor. We also have to understand that there is with age, we are becoming certain, we are losing some of our cognitive facilities. So, our ability to be attentive or to have control over our bodily movements, our thinking patterns becomes less. We become very rigid in our thought patterns in some way. We become very habitual in the way we are working and functioning. We don't want to change our habits. So I think what has happened is there are a couple of things. One is, understanding there could be age-related issues, which may also lead to a depression. As we age, we also tend to start having fear of death, especially with COVID. A lot of people have been reporting that there's a constant panic or an anxiety, which then tells them to feel very low about what if I die, what happens to my family, if I'm the earning member, who's going to take care of them, my daughter is not married, or various issues that come up. Also, I think the whole loneliness factor, the losing connection, a lot of people were not very tech savvy, and today have to become tech savvy. They're not able to meet their children or their grandchildren. So I think the loneliness, and with we bring a lot of meaning and purpose to our life as we age. So I think there's a transition in the way we think, and I think that needs to be helped. So bringing some kind of meaning and purpose to your life right now through the pandemic, it could be learning something new. I know many seniors who have started the home kitchen for themselves, which is empowering them to sustain through the pandemic phase.
Definitely.
I think here what is important is also for them to realize aspects of their life which they can control and which they cannot control. So having a very objective, realistic expectation, having a very, fine acceptance of these are the factors that I can control today. And that sort of reduces the gap between the ideal and the real.
Definitely. I think that is something, if we have, senior participants in our session today, something that they can take into account. And for others, I think they can definitely communicate and uh, assist them, I think, in dealing with the pandemic better. Because
Right.
in the end, all of us are, looking for ways to deal with it in our own best manner possible. So this is
And you
definitely
have to remember, as humans, we are social animals. I mean, we evolved like that. So I think maintaining that certain connection, just trying to connect with them, maybe not for, any work, but, how was your day? What did you do? Getting your routine spoken. I know a lot of people who have even connected with their parents or their grandparents and spoken about past issues and sorted them out. So, if there have been certain underlying themes which you have not spoken about, I think this would be the best time.
definitely. That's an interesting point. Uh, Coming back to, I think, children, we've had a lot of questions with respect to children, especially, and this one is about how, given that depression is prevalent in children too, but parents often ignore them or do not take it seriously. How do
Right.
you think should that be dealt with?
So, definitely, parents sometimes tend to ignore these symptoms. But I think right now, children are very, very active enough, very, very objective enough to say, I want to talk to somebody. So, try to see if there are common themes as parents. So if there are any common themes that the child is reporting in terms of darkness, ghost, fear, you will try to understand that the child is not coping well. In terms of going to school, so a lot of children will withdraw from school or withdraw from a particular area. So if they've been if they're hurt or they're angry, they are not able to understand. One thing is that children find it very difficult to emote. They do not have the emotional vocabulary to state out the emotions as much as adults. So one is we need to teach our children the vocabulary, that you can get hurt, you can get angry. Do not dismiss their anger, do not dismiss their feeling, but teach them appropriate ways of handling the situation. We have a lot of self-help books, we have a lot of people doing great work online, putting up their videos. I'm sure part of your project would also be that. So I think we need to understand that the child does not have the coping mechanism, is relieving his frustration and anger through these tantrums, and then enabling him and helping him out to cope.
Right. Definitely. And also, I think on that lines, we had another question in terms of, sort of building on to the current discussion. Do you think conducting courses or workshops related to mental health at the school level can, assist in this process?
Oh, I think definitely. I think many people have already started doing that. Schools have started doing that. So they do have, I'm aware of a lot of schools, international schools who are checking, getting their classroom counselors to come into the Zoom classrooms and checking which child is responding at what rate, and is the child comfortable with the online classroom. If there is anything the child is avoiding, even on a digital platform. So definitely there are workshops being conducted by schools, on how to cope, enabling them to pass through the pandemic. So yes, getting that emotional vocabulary right from the grade one, will definitely help and empower children, and will also then further reduce the stigma, reduce the rates of depression, anxiety, addiction is, which are very prevalent and which are very, very high currently.
Right, right. Certainly, it's nice to hear. I mean, I wasn't aware of schools
Yeah, I
proactive.
think schools in Bombay have definitely started doing.
That's great to hear. I really
Yeah,
hope that in other parts of the country too, uh,
right.
they follow. And as you mentioned, it's going to be a great step in
And I
eradicating
and
stigma.
I think in CBT and REBT we had structured programs for children. So we have structured techniques which have already been researched and put up. So all therapists have to train themselves in those techniques and start using it. So I think there is a full emotional curriculum which has been designed for children in terms of handling the emotions.
Definitely, that's nice to hear. I mean, we really hope that it works out well and we see progress there. Okay, now that we're inching towards the end time, I'm gonna quickly go through some of the questions we have. The first one is, do you think there exists any correlation between depression and dissociation?
In what terms is the dissociation? Sorry, I didn't get the question properly.
It's
Is
essentially
it
about.
dissociative? Is it a dissociative disorder? Is he talking about? Because that's another disorder in therapy, in psychology.
Mm, Okay, so we'll, I think, move on to the next question, which is about nightmares and how are they related to depression?
So I think what nightmares could be a sign of anxiety. Could be that the brain is, obviously we require some form of sleep, an adequate amount of sleep. Quality of sleep is also important. So if the child is waking up in a nightmare, extremely fearful, you can sort of identify the theme of the nightmare. So is it related to death? Is it related to abuse? So a lot of abuse cases you will see that the child has repeated nightmares, extremely fearful, extremely withdrawing. And then we start, because those children don't tend to talk about the abuse. And I think this is very, very important because they require a very sound, safe, secure environment. So even in therapy, the child may not report the abuse for the first two sessions till they actually feel that secured.
Right. I think then now we're gonna move towards a closing note. We've had a great session today, understanding depression. Not again, I think re-emphasizing, reiterating that please do not self-diagnose, seek a professional help. And as Shraddha has also mentioned, that you can also opt for a single session, especially if paid attention at the right time. You may not require I mean, it can be dealt with sooner, quicker, and uh, it may not prolong, it may not be expensive as well. And to start with, we've also had, I think we have a detailed insight as to what are the various symptoms. And especially, I think the best part is how we've understood it from different, not just from a geography angle, but also from different age groups, different sections of the society, right? So, understanding it from the gender angle, and also from a personality angle.
Right.
So
And I think what is very important is to realize A is the coping mechanism. Like I said, the support mechanism of the person. So the individual, whether he or she has the coping mechanisms to handle the issues or the problems of his life, whether he has the right support in his family and friends, is there any self-defeating pattern in, cognitively? So is he, working in a pattern that is not helping themselves? And often enough, we see people in depression who are going through a lot of guilt and self-blame, and have very perfectionist standards of, I should have been here, I should have achieved this, and so they constantly are in that loop. So enabling them to get out of the loop, breaking their patterns, becoming more flexible is I think which will empower them to see that life is not that bad.
definitely breaking the pattern is
Right.
the key. And also, as you've mentioned, that when it comes to the treatment forms, there are well structured assessments to undergo the process. So please do not hesitate getting professional help. And yes, I think on a closing note, Shraddha, could you please share some information? I mean, we heard about your foundation, Ray Reality, and you, if you could just give us a
Sure. So the foundation basically has also been started in COVID. It is basically to reach out to the general population. I have personally been a part of a lot of helplines, with various doctors across the country, to help people by and large with their cases of anxiety, which significantly rose in terms of COVID. Today, what we are also seeing are higher cases of depression, addiction, like I said, and we are trying to cater to all groups of population, from the youth to the middle age. People are having a lot of relationship issues. So we are trying to, one, the goal of the foundation is to create the awareness and also start enabling people to get, some kind of a toolbox, cognitive techniques to enable them to cross through the difficult phases of their life right now. So, we are doing a lot of workshops with organizations, corporate organizations as well. Work from home has been very challenging for a few people. Multitasking has been very, very draining. And I think now, 6 months into the pandemic, most people have reached their fatigue and burnout. So the goal is to have something called, build their resilience, have post-traumatic growth, which is, what are the factors that can help us go through this difficult phase. So I think the goal of the foundation is to reach out to common people on that. A note, I think we people also have to start being accountable for their emotions. So I think right from the start, we want to teach people that, instead of this whole blame, seek accountability for where you can decide what you want in life. Therapy talks about change, and change comes from choice. So you make a commitment choice, a choice to commit to change your life in the way you want to change.
definitely. Those are some strong words, and I think
Yeah.
that should stay each time there's hesitation, each time there is confusion. I think it's important to come back to this, and also I think just adding on, given that the numbers don't really seem to be stopping or declining, it's critical that we need to take this time as an important period and act upon it rather than pushing it back.
Right. No, I don't think the numbers are definitely coming down. I think what we are estimating is a mental health pandemic post COVID vaccine comes out. So people are still sailing through the pandemic, which is the cases in most kind of trauma. As psychology has studied, in any form of traumatic events, the people cope through the trauma, and then it sort of takes a fatigue or a burnout, or they are extremely, they sort of come to terms with the pain and the acceptance of the pain. So I think we are still far away from that. We are going to see our rates rising in terms of depression. But I think the critical thing is to remove the stigma. It is something that can happen to anybody at any age, regardless of the religion you belong to, the age bracket you belong to, the gender you belong to, the status you belong to. So you need to understand that it's okay to seek help. you
Definitely.
know yeah.
That's true. I think hearing it from you should definitely, you know, help.
Yeah.
I think, yeah. On that note, let's wrap up our session. We've had a great session in terms of interpreting depression. I really hope that all of us can inculcate the information we've received today and take action upon it. And thank you, Shraddha, for sharing these wonderful insights with us today and enlightening us when it comes to depression.
Thanks.
And
I just wanted to say that, psychology and therapy is not only about depression and finding clinical problems in the patient. I think it is also about positive psychology. So psychology is also teaching you how to bring positivity back to your life. Engaging in tasks, like you said, getting the mindfulness, understanding what your strengths and weaknesses are. So even if you're not depressed, you can go into therapy, seek that additional help for yourself to empower yourself.
definitely, definitely. Thank you so much for those wise words. We
Thank
will
you.
definitely, we hope to connect with you again on a similar interesting topic and understand the various mental health disorders that exist from an expert perspective. Thank you everyone for joining our session today. We will be back next Sunday, same time, with decoding a new another disorder. And yes, on that note, have a great Sunday.
Thank you so much. Thank you for having me.
Thank you. Bye bye. Have a nice Sunday.
A clear distinction is often made between the mind and body based on the premise that they both are fundamentally different in nature. But when considering the mental health and physical health, don't you think that they both are interconnected? Mental health is a sensitive topic as there exists a lot of stigma and discrimination around it. Mental illness is assumed to be like an unwanted thought for some time, which will go away on its own. Emotional pain is not as visible as the physical pain. A cut on a finger will receive more attention than the sudden prolonged silence of a person. But do you know that poor mental health leads to an increased risk of developing physical health problems? And similarly, poor physical health can negatively impact a person's mental health, leading to an increased risk of poor health conditions. Stigma and discrimination can also worsen someone's mental health problems and delay or hinder reaching for help and treatment. According to WHO, 1 in 20 Indians suffer from depression. It has also been found that depression is associated with an increased risk of coronary heart disease. Healthy Minds World brings to you a Sunday webinar series, a series of 5 weeks on decoding mental health disorders to eradicate the stigma and myths on various mental health disorders like depression, suicide, anxiety, bipolar, and many more. Every Sunday at 11 a.m. IST, we will understand one mental health disorder from some of the leading psychologists in country.